Welcome to Knowledge on the Go, where we explore the leading practices that have emerged in Vizient's performance improvement programs. I'm Laura Hoffman, Senior PI Program Director at Vizient and your program host. Imagine the stress of returning to school following a psychiatric hospitalization for the pediatric patient, their family, and caregivers. Dr. Sarah Edwards, Director for the Division of Child and Adolescent Psychiatry, and Courtney Vaughn, School Transition Specialist at the University of Maryland, join me today to explain how their school transitions program helps these patients and families adjust to that transition. Sarah and Courtney, I'm delighted you're joining me today.
Thank you so much. It's great to be here.
Sarah and Courtney, start us off with an overview of the school transitions program, your role, and a little about why you started this program.
We're really excited to share this program. It started back in 2012, was initially called the School Transition Program. We then later renamed it BFAST, which stands for Bringing Families and Schools Together, to highlight the collaborative part of the families and the schools working with each other. This program is offered to all families of youth admitted to our inpatient psychiatric unit, and it provides supports to students and families and school staff as the youth returns to their school and community after a psychiatric hospitalization. This program is free. It's a 3-month transition support program in which they receive a school transition specialist and a family connector to be working with the families.
And my role as the school transition specialist is really to be collaborating with the family and school to create an individualized transition plan for the student to make sure that they have a smooth and successful transition back to school. Ideally, I like to reach out to schools before that student has been discharged from the hospital to make that connection and schedule that transition meeting so that all of the key players can meet prior to that student returning so that we're all on the same page and that the student has the appropriate supports once they return. We also want to support and encourage the family to advocate for any additional services at school that their child might need. I'm able to participate in any school meetings that take place and also work with school staff to ensure the student is supported. It can be extremely overwhelming for the caregiver to know how to navigate the whole educational system, especially after having a child that's recently experienced a hospitalization. We want to make sure we're supporting the family with that entire process. In addition to all that, I also collaborate and work with what we call a family connector, who is an integral part of our program.
It's interesting, Courtney, that you mentioned you collaborate with a family connector. Who is this person and how do they provide emotional support?
Our family connector is a parent and also a grandparent who currently has children that have some emotional and also educational needs. And we have trained her to be a peer support for all of our caregivers because we know this is such a stressful time for the entire family that we wanted to make sure we were supporting these caregivers during this process as well. Our family connector reaches out via phone, so she makes phone calls to all of our families at least once a week to provide that emotional support, but also to provide any resources or information that that family might need. She does have a lot of similar lived experiences as our families. The feedback from all of our families is that they really appreciate having someone that's not only checking in on them, but that can relate to a lot of what they're going through. She's a huge part of our program, and our families really appreciate that support.
Courtney, you've shared about the support for the family through your program. What are the program elements that help the youth to stay on track?
We offer one specific intervention to our families and schools that's called Connect and Reflect. And the idea behind this is that these are structured check-ins that the student would have with a trusted adult. We do talk to the student about, is there anyone in the school that you already feel supported by, that you do trust, that you would be comfortable checking in with upon your return back? These check-ins are scheduled, so we like to have them at certain times throughout the day, and that kind of varies depending on that child's needs. And they are supposed to be brief. The adult is really just checking in. How are you doing? Goes over any kind of coping skills. What's our plan for the rest of the day? We really like that these are scheduled so that the student doesn't always have to take their own initiative to seek somebody out when there is a problem. And we like the idea that they're having these check-ins no matter what. They could be having a great day and they still get this check-in. So they're having more positive interactions with staff members as well. Not just getting that attention if they are having difficulties. When we offer this to families, they are relieved because they're very nervous, as we would all be, having our child return back to school following a hospitalization, just for their safety and everything else that comes along with that. How are they going to adjust? And I think them knowing that there is a trusted adult within the school building that their child is checking in with on a regular basis is a huge relief. We've gotten a lot of positive feedback about that intervention.
Wow, this is really a comprehensive program, and I imagine that this has helped a lot of families. Sarah, can you share some of the impressive outcomes since starting this program?
Absolutely. We recognize that this program is so important that we have been able to continue it with hospital support. So initially, when our program started in 2012, it was a grant-funded program. And then we recognized that we have to do more for our children and families, that we do a great job of taking care of them when they're in the hospital, but we have to make sure that that great work continues. Some of the things we've looked at are important metrics such as 30-day readmissions. We have found that on average each year, we're able to decrease 30-day readmissions between 1% and 2%. We haven't looked at the most current fiscal year, but prior to that each year, it's about 1% to 2% when you compare the youth who participate in this program to the youth who do not participate in this program that were hospitalized at the same time. Some other really impressive data points that we have been collecting have to do with things like parent satisfaction. And our parents feel that they are getting their needs met. When you compare youth who are not in this program or youth who participate after the program, 94% feel like their mental health needs are being met now. When you look at pre and post data, only 10% upon starting this program feel like their needs are being met at schools. That has to do with whether or not the youth has special accommodations or if they have special school services and IEP. And then you compare that with the post data and it goes up to 79% feel like their school services and their school needs are being met. So we know that this free 3-month transition support program is really making a difference.
Have you received any feedback from the patients and families?
Yes, we've been lucky enough to gather some post data, and some of the qualitative information lets us know that families say things such as, quote, "The BFAST team participated in every school meeting and helped me advocate for my kid. They even helped me get an IEP after I had been trying for years." Another family who was commenting on the family connector said, "I'm really going to miss having the family connector to talk to. She listened to me without judgment and could relate to a lot of what was going on. It was also nice just to have someone call me every week to check in."
Sarah and Courtney, what has this program meant to you from a personal or a professional standpoint?
It has meant a lot to me professionally and personally because on the inpatient unit, you see kids for a brief period of time. Most of our work is about crisis stabilization. You get to know a youth or a family for about 1 to 2 weeks on average. And knowing that the great work that we start there can continue into the community and really make the youth successful makes the biggest difference. We know it's so stressful for the families to be in this position, and recognizing that they report that this program helps them feel better, feels like their needs are being met, has been an important part of my career, knowing that we've been part of developing this program and then importantly sustaining this program.
For me, it's been really rewarding to be able to support families, as Sarah mentioned, during such a critical and overwhelming time. Being able to specifically focus on that transition back to school is just amazing because there are so many families and students that do not receive that type of support. Having this program and being able to offer something that makes that process a little less overwhelming for these families and students means a lot, both personally and professionally.
Well, I would love to continue this rewarding conversation, but unfortunately, it's all the time we have for today. So thank you, Sarah and Courtney, for sharing how you're helping our youth and their families transition back to school after experiencing mental health issues. And thanks again to our listeners. Please join us for more Knowledge on the Go. Subscribe today, like us, and send us your comments at picollaboratives@vizientinc.com. From Vizient's PI Programs team, I'm Laura Hoffman. Have a great day.